Good evening, ladies and gentlemen. Thank you all for joining us today. I'm already seeing many participants coming in to our room here, and I'm seeing more coming in. We'll be starting very soon in 3 minutes. You are seeing the poll on the screen now. Feel free to fill up the poll that we are showing on the screen so that we can understand a bit more demographic of the participants here today. You'll be muted throughout this whole session, and make yourself comfortable and stay tuned for a fruitful session ahead. Today's session is also broadcasted live on Facebook. So we will be starting in 3 minutes. We'll see you shortly. Alright, good evening fellow Malaysians, ladies and gentlemen. Thank you for joining us today. I hope all of you are doing well, staying safe and well. Thank you for joining us for inspiring your time with us to learn more insights on eye care, especially during this trying time when technologies and screen time has become even more inevitable. I am Carmen Tham, an optometrist from Vista Eye Specialist, and I'll be your moderator for today. Now, before we begin, allow me to briefly introduce to you about Vista Eye Specialist. Now, with the mission to safely help people from seeing from blur to clear, Vista Eye Specialist was established in the year of 1999, and we are now marking our 21st year of milestone in the industry this year. We provide eye care services and treatments for all range of ages from 4 years old to even the elderly group. So we also cater to kids' eye examinations, therapy for lazy eye, and myopia control. Also catering refractive surgery such as eye LASIK, ICL for the young adults who desire their freedom of vision. Moving forward, as for the elderly group, we also provide services and treatments such as lens exchange surgery, cataract treatments, dry eye therapy, and so on. We now have 11 centers nationwide, and we are also anticipating 4 more new locations coming out in the coming years. Now, let me just remind everyone again, we are now broadcasted live on Facebook, and we are seeing many participants still coming in on Zoom and as well as on Facebook. Do stay tuned with us until the last session, and feel free to actually, drop us a message on the chat saying that you are fine, our audio is great. So keep this coming as we're going along. Now, before we begin, we are very pleased to bring you today's webinar organized by our media partner, Star Media Group, to discuss on the causes, effects, and what are the solutions in managing a good eye health after this grueling MCO, which now has entered into day 51 for most of us here in Malaysia, and why we should take actions or immediate actions to prepare our eyes for post-MCO. Joining me this evening, ladies and gentlemen, we are very honored to have three esteemed ophthalmologists from Vista Eye Specialists, Dr. Vienne, Dr. Anson Ko, Dr. Alan Ko, and Dr. Anson Tay. They will be sharing with us today on highly concerned eye care related topics such as digital eye strain, which is one of the causes of dry eye disease, cataract, how we shouldn't let cataract hold us back, and why we need to see an eye doctor. Each speaker today will be presenting their topic between 10 to 15 minutes, and this will be followed by a Q&A session at the end after all three presentations are conducted by our respective speakers today. So do stay with us until the end for more sharings from our speakers today to answer all your questions regarding to eye care. And if you have any questions, feel free to start typing in all your questions as they are speaking in the Q&A selection on your screen. You will see that a small box at the bottom, and we will have to pick questions selectively as time is of its essence at this point of time. All right? Okay. So again, for those who have just joined us, thank you so much for tuning in, and we are now live on Facebook, and this is bringing in about eye care topic. So without further ado, let us dive into the first topic of the day by Dr. Vienne. Dr. Vienne is the consultant ophthalmologist, cataract and refractive surgeon in Vista Eye Specialist, and she truly believes in joyfully blessed with the hands to help people see. She will enlighten us today with her topic, digital eye strain, one of the causes of dry eye disease. Over to you now, Dr. Vienne.
Thank you, Carmen. Let me share my screen first. Hi, a very good evening, ladies and gentlemen. I'm Dr. Vienne from Vista Eye Specialist. I would like to share with you the digital eye strain is one of the causes of dry eye disease. There are a lot of media coverage stated that during this period of movement control order, people tend to use more electronic devices and exposed to prolonged screen time. Prolonged screen time exposure not only confined to adults who are free and try to occupy their time with devices, but it also involves those people who are working from home during this MCO period. So for prolonged screen time does not spare children as well. Why does not spare children? Because we know our children also need to learn at home, where they need to involve in the Zoom teaching from the school teacher as well. Okay. What would happen if we have prolonged screen time more than 2 hours? I have a patient who works in front of the computer for 11 hours per day. She complained to me that she has difficulties in seeing things, means blur vision. She has a bit of headache and nausea after half a day exposed to screen time. I guess maybe some of you may also have the similar complaint like what my patients complain. Okay. If you have eye strain, headache, blur vision, dry eye disease, and neck and shoulder pain, all those are classified as digital eye strain. Digital eye strain, which with the internal symptoms of strain or headache, will link to the accommodative or binocular vision. It means in order for eyes to maintain focus at near, we will take extra effort to focus at near compared to looking at a distance object. Where when we're looking at a distance object, our eye is more relaxed. So if you have a prolonged exposure to the screen time, this will cause a lot of burden for the eye and will lead to the headache and straining of the eye. And another symptoms which is related to the digital eye strain will be we call as the external symptoms, which is including burning sensation, irritation, and tearing, which all those are related to dry eye. So in this issue, dry eye will be very important for us to focus. So I will focus more on the dry eye. There are 25% of people who visit our clinic reported to have dry eye. And this is actually very common condition that's seen by us every day. And a meta-analysis in the 2016 estimated that an overall prevalence of dry eye disease, specifically in those people who use the computer most, is about 49.5%. Actually, it's quite high. So what actually is a dry eye? Dry eye actually is a multifactorial disease of the tears which result in the discomfort, visual disturbance, and tear film instability. Actually, dry eye here means is a multifactorial disease. So it is not one cause can cause not only one cause can cause dry eye, they can multiple causes. So basic knowledge about tear film. Tear film consists of the 3 layers. The first layer, innermost layers will be mucus layers. The second one will be watery layers. And the third one will be, we call as the oil layers. And these oil layers actually is very important. All these 3 layers are very important. Especially now I want to focus on oil layer because oil layer can prevent evaporation of our tears to the environment. And these oil layers actually is produced by these mammalian glands. Except for this exposure to the digital and also our devices for long hours, other causes of dry eye can be because of aging. For those people who are more than 50 years old, they tend to get dry eye. And also prevalence is more in the dry eye prevalence is more in the female because of hormonal changes, especially for those postmenopausal female. And dry environments such as under air conditioner or there is a fan that directly blow on us also can cause dry eye. And dry eye also usually related to those who are contact lens wearer. Post-LASIK patient tends to get dry eye as well, or those patients who are taking the diet intake lacking of the omega-3 also can cause dry eye. Others medical conditions like diabetic mellitus, thyroid problem, or autoimmune disease also can have dry eye issue as well. Inflammation of lid margin definitely can cause dry eye. Certain medication like antihistamine, beta blocker means the antihypertensive medication, the treatment for the hypertensive medication will cause dry eye as well. So what are the symptoms that usually patients presented with dry eyes? Okay. Patient may complain of gritty sensation. Some patients do tell me, hey doctor, why I got this steady feeling inside my eye? Is this some sense enter my eye? But they don't record any incidents of any foreign body enter the eye. So this is what we call as gritty sensation. And some patients will tell me it's like, look like burning sensation, feel like burning sensation, stinging in a feeling, irritation, feel that your eye is not comfortable, they will have some redness, and also the tired of the eye, you can't open the eyes, especially towards the evening. And some also will complain of the intermittent blurry vision. Sometimes the vision is clear, sometimes the vision is not clear. And some patients will complain of the sensitivity to light, especially driving at night. They see a lot of glare. And some do have some itchiness, and also some will complain of tearing eye. One of my patients asked me, doctor, why you say I got dry eye, yet actually I have teary eye? Okay. Teary eye, actually, watery eye, actually is the result of the reflex from the dry eye. So when we have dry eye from the beginning, the cornea, means our eye, will send the signals to our brain, and the brain will ask the eye produce more tears. Actually, from the starting, actually, it's because of the dry eye. So what are the tips that or remedies that we can do at home or to ease, to relieve our problem? Okay, what we can do is, we can do 20-20-20. We can follow the 20-20-20 rules. Okay, after 20 minutes of reading, we can stop about 20 seconds and look at the 20-feet object to relax our eyes, and try to increase our blinking when we expose to the computer, and try to reduce the brightness of the computer if you found that the screen is too glare for you. And some of you actually can use some artificial tears, which preservative free will be more recommended. Cleaning of the eyelids, you also can do some cleaning of the eyelid, like every day after taking bath, you can do some cleaning of the eyelid. And this cleaning of the eyelid usually will be the area that we missed, and also we not routinely do. Warm compression also important. Some of my patients do tell me, "Hey doctor, your suggestion for doing warm compression is really help. It really can ease my dry eye." So if all those measurements you had done, but you couldn't help to relieve your problem, then it's advised to seek the doctor's consultations. So what do the doctors usually do? Usually doctor will examine your eyes under the slit lamp, and they will do certain tests if necessary, such as Schirmer test, mammography test, or the chill osmolarity testing. There are few options or there are few treatments for dry eye. The first one is including the environmental modification. Like just now I have mentioned, try to avoid the dry environment, try to avoid the aircon or fan directly blow on you. Try to reduce the screen time. Go more outdoor activities will be better. Dietary, we can increase the omega-3 intake to our diet. And also is encouraged for us to drink more water. We also can adjust the medication that we take, such as the antihypertensive medication. Let's say the beta blocker, you have taken the beta blocker antihypertensive medication, which we can switch to other type of the antihypertensive medication. So we need to co-manage with the physician. Regarding the dry eye, the most simple ways that usually we can give you artificial tears to substitute the dry eye, or for those who are like more moderate and also to severe dry eye, we will give gel or ointment. And more severe, the severe type form of the dry eye also will give treatment of punctal occlusion or autologous blood. Okay. Dry eye usually will associated with the inflammation. So when the doctors looking at your eyes, they notice that you have some inflammatory component, so they will start the steroid for you. This is for the short-term usage only. For the long-term control of the inflammation inside the eye, for the dry eye patient, sometimes the ophthalmologist will opt for the topical cyclosporine. And for those who have lid problem, like lid margin inflammation, we will give patient oral doxycycline, which they have the dual function, means as an antibiotic and also the anti-inflammatory component. So to treat the mammalian gland, what we can do is try to clean our eyelid routinely every day, and after that we can perform some warm compression. If you find that it's a bit hard for us to clean our eyelid, then we can do the black wax. It's a special tool to help in the cleaning of the eyelid. Or we can do intense pulse light for those who have more severe dry eye problem, which related to the mammalian gland dysfunction. So with that, I thank you.
Thank you, Dr. Vienne.
I try to stop share.
Thank you, Dr. Vienne. Very informative tips for all of us. We can start practicing now. I think what Dr. Vienne has shared is very relatable to most of us, especially when we are now sitting in front of the screen. Even more prominent during this MCO period where, the norm of digitalization is actually very common. Dry eyes may affect your quality of vision and even your quality of life, but it is more important for us to start doing something with it, even if it is as simple as taking a break during your screen time. Now, before we move on, feel free to drop your questions on the Q&A column below, not on the chat box. We will address your questions shortly during the Q&A session. Now, talking about affecting the quality of vision and your life, if your vision is blurry or cloudy persistently over months or even years, especially if you are 40 years old and above, then perhaps dry eyes may not be the only reason. The deterioration of our vision could be caused by something even more alarming, such as cataract. In fact, a national eye survey conducted in Malaysia has shown that cataract is in fact the leading cause of preventable blindness in Malaysia. Now, moving on, we will have Dr. Alan Cole, which is the Senior Consultant Ophthalmologist, Cataract and Refractive Surgeon in Vista Eye Specialist, to dive in a little more about cataracts with us with his topic, Don't Let Cataract Hold You Back. Over to you now, Dr. Alan.
Okay, thanks, Carmen. A very good evening, ladies and gentlemen. I'm Dr. Alan from Vista Eye Specialist. So today I'd like to talk something about the most common eye disease, the cataracts. So normally in Malaysia, based on experience, most of the patients with cataract often wait until their cataract is more ripe or mature, or when their vision really bad before they get their cataract surgery done. So why? Because first, because of the old belief, they think that they need to wait until right before they can do it. Second, people think that they can save more cost because when they do later, when the cataract is more, they're more worth it or the price can be more cheaper. The third, a lot of people hope that their cataract will not get worsened. Waiting is actually okay for some, but we have to understand that your cataract may progressively become more and more mature. This will increase the risk of your surgery, making it harder to remove or more likely to have other complications.
Sorry, Dr. Alan, I think you might need to speak a bit louder. Some of the audience can't hear you too well.
Okay, let me start with some general fact about cataracts. Cataract is the #1 leading cause of blindness in Malaysia and also the most common cause of vision loss in people over age 40. And 216,000 Malaysians become blind because of delayed cataract, according to the National Eye Survey done in 2016. So what is actually a cataract? Okay, cataract is clouding of the natural lens, will lead to decrease in vision. Most commonly, the cataract is due to aging, but can also cause or progress rapidly due to external factors such as medical condition like diabetes, prolonged use of certain medications due to trauma or other eye disease, and can be born with cataracts. Okay, in the normal eye, the natural lens, clear lens will allow the light to focus, help the light to focus over retina to help you to see a clear image. But the eye with the cataract, your lens is cloudy, and this can reduce the transmission of the light and disperse the light. So your image is blurred and clear. Okay, so what is the symptom of cataracts? So if you complain of blurring of visions, okay, you may have double visions, and also you may complain on dulling of the color, and some people may complain frequent change in glasses vision. They may have poor night vision. They complain of glare halo and also sensitive to strong light. The only way to be sure that you may have cataract is to see a qualified eye doctor. So once the eye doctor confirms that you have a cataract, so what is the treatment? So until now, there's no pill or eye drop which can actually resolve the cataract. Surgery removal is the most effective way to restore your vision. A lot of patients will worry about the risk of surgery. Just to reassure you that cataract surgery actually have evolved in the recent decade to be an incredibly safe and straightforward treatment with life-changing results. Cataract surgery is actually the most done surgery in the world. Just in year 2017, 3.8 million cataract surgery were performed just in US. So how the cataract surgery been performed? So basically, the cataract surgery consists of 3 simple steps. So first step, we actually make 2 to 3 incisions at the cornea to allow instrument, or we call the probe, to enter. The second step, the ultrasound probe used to break down the cataract and remove and suck it out. And then third one, an artificial lens is rolled into an injector and inserted into the capsule bag and unrolled into the positions. The whole cataract procedure actually will take about 10 to 15 minutes, and usually it's under local anesthetic and is painless and done at the daycare setting. Okay, nowadays, currently, the cataract surgery actually evolved into what we call a no-blade femtosecond laser cataract surgery. In this new generation of surgery, many steps in the standard cataract surgery is performed by laser. So the advantage of this surgery will be, first, the surgery is more precise. There's a lower risk of error. Third one, time saving. And fourth, patient have better or faster healing. In the modern cataract surgery, we also can customize your vision after the cataract surgery. There's a different type of artificial lens designed to address additional vision concerns. Okay, so if you're using just a conventional monofocal intraocular lens or artificial lens, you still need reading glasses for intermediate distance, like using computer or handphone. So if you are still active, you're having an active lifestyle, you like to travel around, you like to read, you don't like to wear reading glasses, you don't like to wear any prescription glasses, then you should use a modern trifocal intraocular lens, which can help you to see clearly after cataract surgery for the distant image, intermediate image, and also near image. So currently, because of this COVID-19 pandemic, so most of the government hospitals actually need to focus their resource in fighting the COVID-19. So many elective surgery, include the cataract surgery, actually have been postponed even to 6 months, even to 1 year later. So actually, what is the risk of delaying cataract surgery? So first risk is the cataract can eventually lead to blindness. Second one, they increase the risk of surgery, cataract surgery complication. And the third one, they increase the rate of accident, either a motor vehicle accident or home domestic accident because of poor vision. The fourth one, patient with cataract usually loss of independence and self-esteem. And the fifth one, if the cataract is mature, is dense enough, it can lead to glaucoma and other eye disease. Okay, the last one, if the cataract also can increase the risk of depression. So when to do a cataract surgery? Okay, you can proceed for cataract surgery when you cannot see properly. Okay, second, if your daily activity is interrupted, like driving, especially at night. Second, your job performance is affected. Third one, your reading, your movie, you can't enjoy cannot enjoy anymore. Okay, and the fourth one, if you are wearing a prescription lens but you still getting blurry and blurry, then you need to do cataract surgery. And the fourth one, if you have frequent change of glasses due to increase of power. Okay, this is the end of my presentation. So if you have any question, please write down and I'll answer it in the Q&A section. Okay, thanks.
Thank you, Dr. Allen, for your sharing and for giving us some perspective in understanding about cataract and how it could possibly affect our life if it is left untreated. I think if cataract is already affecting your vision, we should not delay the treatment, especially when the surgery available in the modern era is simple and vital for preventing blindness. Now, dry eyes and cataract are the common eye problem which many of us already know by now. So finding out the right cause of our vision complaints is also equally very important. Each eye problem may give rise to a different symptom, but how do we actually know when there is a need for a medical attention? We will now pass over the time to Dr. Anson, the consultant ophthalmologist, cataract and refractive surgeon in Vista Eye Specialist. Dr. Anson truly believes in caring for his patients, just like how he would for his own. And he will now enlighten us by sharing with us on when do you need to see an eye doctor. Over to you now, Dr. Anson.
Thank you, Carmen. Good evening, ladies and gentlemen. I'm Dr. Anson from Vista Eye Specialist in Vienne. So thank you to Star Media Group for organizing this webinar and giving me an opportunity to share my topic tonight, which is on when you need to see an eye doctor. This is the first time I'm taking part as a speaker in a webinar. I guess this is part of the new normal of social distancing, but it's great how we can find new ways to connect with each other in the virtual space. I don't know what the post-MCO life looks like, but I know that we need good eyesight to see us through it. Before I talk about eye symptoms, let me explain how our eyes work. Our eyes provide us with vision, the ability to perceive shapes, colors, and movement of objects, but they are only one part of the visual system. In this system, our eye works like a camera that focuses light from objects onto the retina, a delicate transparent tissue lining the back of the eye. The retina is similar to a camera sensor and converts light into electrical energy. For light to be focused properly on the retina, it has to pass through transparent ocular media, which is the cornea, aqueous humor, lens, and vitreous body. Our eye is unique because the pathway that light passes through has to be clear to form a sharp image at the retina. After the retina converts light into electrical energy, it is sent to the brain through the optic nerve to the visual cortex, which acts like the central processing unit of a computer. So in order to see, we need a healthy eye, intact nerve connections, and a working visual cortex. Any problems within this complex system will cause symptoms like blurry vision. In general, eye symptoms can be grouped into three categories, which is vision loss or disturbance, and abnormalities in sensation or appearance of the eye and its surrounding parts, including the eyelids and orbit. The most troubling symptom is vision loss or disturbance, because seeing is the sense that we value the most. Vision loss can occur gradually or suddenly, and it can be brief or persistent. There are also different types of vision problems like double vision, distorted vision, floaters, and flashes of light, or color and night vision disturbances. Abnormalities in sensation most often involves pain or discomfort with different qualities and severity, such as foreign body sensation, burning, photophobia, itchiness, tearing, or tiredness. Photophobia doesn't mean fear of light, but sensitivity to light. Different types of headache can be felt around the eye, but some do not come from eye problems. Lastly, there are symptoms related to the appearance of the eye, such as redness, discharge, eyelid abnormalities, eyeball protrusion, squint, and abnormal lumps or growth. Although I have grouped the symptoms in such a way, it doesn't mean that a patient only comes with one symptom. Most patients will have a few symptoms such as sudden blurring of vision with eye redness and pain, and the different symptoms gives us a clue as to which disease to look for. Now let's talk about one of the most common symptoms, which is gradual and painless loss of vision. In adults, the four most common causes are cataracts, glaucoma, diabetic retinopathy, and age-related macular degeneration. The top picture shows a cataract, which is a clouding of the natural lens inside the eye. Loss of vision from cataract is usually treatable and reversible with cataract surgery, which you have heard from Dr. Allen. However, the picture on the bottom shows a very different story, which is glaucoma. Glaucoma is a disease which causes irreversible blindness from damage to the optic nerve. Early glaucoma is silent as the vision loss happens in our peripheral vision, which is not noticeable. By the time you have blurring of vision, the damage is already severe. That is why it is important for those over the age of 50 to have a yearly eye check to detect this silent thief of sight, especially if your family members have glaucoma. The left picture shows central vision loss from macular disease. The macula is the central part of the retina which gives us the ability to see detail and color vision. A disease at the macula is quite noticeable because we rely on our central vision for tasks like driving and reading. The center picture shows diabetic macular edema, where the macula is swollen with fluid. It is treatable, but you need to have good control of diabetes and coexisting medical problems like hypertension and high cholesterol. The right picture shows age-related macular degeneration or AMD. There are two types of AMD called dry and wet. Wet AMD is more severe where abnormal blood vessels grow under the macula, causing bleeding and leakage of fluid into the retina. This causes straight objects or lines to appear crooked or distorted. Wet AMD is a chronic disease which often requires treatment with regular injections of a drug into the eye. But if you come late, there may be irreversible vision loss due to scar tissue formation at the macula. Those with gradual and painless vision loss usually wait a while before coming to us, as they want to see if the problem can go away on its own or not. Since these conditions are painless, it doesn't prompt them to see doctors urgently. But this is not right, as early diagnosis and treatment will often give a better outcome. Sudden vision loss occurs over seconds to minutes, sometimes days. It can happen during an activity like watching the TV, driving, or even upon waking up from sleep. Although mostly painless, this is an eye emergency which requires urgent assessment because it is serious, even if it only affects part of your vision. Most causes of sudden vision loss come from blood vessel problems like blockage or bleeding. The left picture shows central retinal vein occlusion, a serious condition where the main vein that carries blood out of the retina is blocked, leading to a shortage of oxygen in the retina, hemorrhages, and swelling of the macula. This is like a stroke in the eye, and vascular diseases such as this signal a risk for stroke and even heart attacks. The left picture shows vitreous hemorrhage, a bleeding into the gel of the eyeball which happens from advanced diabetic eye disease. Such severe eye diseases can cause blindness if not treated promptly. Sometimes sudden vision loss does not come from the eye itself but from the brain. The left picture is an MRI scan of the brain showing an infarct in the left occipital lobe, here, which means a stroke in the visual cortex, visual processing center of the brain. Very often, patients with occipital stroke think that they have lost vision in one eye, but testing the visual field will show that they have lost half of the visual field in each eye. I'm reminded of a patient who walked into our clinic about a week ago. He noticed blurring of vision in his left eye since a few days ago and was blind in the right eye from an injury long ago. I thought to myself, this patient must have a real problem if he took the trouble to come during MCO. His eye examination was normal, but when we tested his visual field, it was like the picture shown, and he had lost half of his visual field in his only seeing eye. That is a real life story. As patients with stroke can have visual symptoms only, we as eye doctors have to diagnose them correctly and make sure that they receive appropriate care by a neurologist. Now we come to a very common symptom called floaters. They are commonly described as spots in the vision, which are gray or black, that drift about when you move your eyes. Floaters come in various shapes like dots, strings, and cobwebs, and are more noticeable when you look at a plain background like the sky. The space inside our eyeball contains a jelly-like substance called the vitreous, made up of collagen and other substances. When collagen fibers in the vitreous clump together into dots or strands, the shadow that they cast on the retina are seen as floaters. This usually happens from an age-related change called posterior vitreous detachment, but they are also common in younger people who are short-sighted. Other causes of floaters include bleeding into the vitreous and inflammation inside the eye. What is PVD? It is an age-related change which happens when the vitreous gel becomes more liquid and shrinks, causing it to peel and separate from the retina. Most people experience this after the age of 60, and the process happens over 1 to 3 months, during which you may experience floaters and flashes. Flashes are streaks of light that occur at the sides of your vision and happens when the vitreous pulls on the retina. PVD is usually harmless, and most people no longer notice flashes after 3 months. Floaters tend to improve, but some will remain. However, if the forces of vitreous separation are strong and concentrated on a particular area of the retina, the PVD can tear the retina as shown here. A retinal tear can cause bleeding into the vitreous gel with a sudden onset of new floaters which are much more than usual. More than that, a retinal tear can lead to retinal detachment, an urgent condition which causes permanent vision loss if left untreated. The symptom for retinal detachment is darkness like a curtain on any side of your vision. Although the majority of patients with PVD never develop serious complications, it is recommended to have a checkup, as any retinal tear could be treated with laser before it progresses to retinal detachment, which will require more extensive surgery to fix. Another very common symptom is eye redness, which can affect one or both eyes at the same time. The redness comes from dilated blood vessels on the surface of the eye due to some irritation, infection, inflammation, or injury. As many conditions can cause eye redness, an important point to take note is the pattern of eye redness and the type of pain which you have. For example, a diffuse red eye is commonly due to bacterial or viral conjunctivitis, sometimes called a pink eye. A localized red eye can be due to conditions such as scleritis, which is inflammation of the white of the eye itself. Redness around the cornea can mean a corneal condition, such as abrasion or inflammation inside the eye, such as anterior uveitis. A special type of red eye which I would like to mention is subconjunctival hemorrhage. It appears as a patch of redness over the white of the eye. Oftentimes, the condition is noticed by someone else or when you look in the mirror because it is painless. The conjunctiva is a transparent mucous membrane covering the white of the eye and inner eyelids. The subconjunctival hemorrhage happens when the tiny blood vessel under the conjunctiva breaks and blood gets trapped underneath. It is like a bruise, which is a collection of blood underneath the skin. But because the conjunctiva is transparent, we can see the blood clearly. Although it looks scary, the condition does not harm your eye and the blood gets absorbed over time by itself. The most common cause of subconjunctival hemorrhage is due to injury, even a relatively minor one like rubbing or straining, but sometimes it can happen without any obvious reason. Risk factors include hypertension, certain drugs or nutritional supplements, and bleeding disorders, but the last one is rare. The last condition is a painful red eye emergency called acute angle closure glaucoma. Our eyeball has a shape and firmness because fluid is constantly produced within the eye and drains out from an area called the drainage angle. Sudden blockage of this area will cause a sudden rise in eye pressure with severe pain in and around the eye, sometimes with headache on the same side as the affected eye, nausea and vomiting. The vision becomes blurred and there may be halos or rainbows around lights. Some people have repeated episodes with milder symptoms and no pain. The repeated episodes of angle closure may lead to severe vision loss without you realizing it. Acute angle closure glaucoma needs urgent treatment to prevent vision loss. In summary, the point that I'd like to drive home is that every common eye symptom can have many causes, some of which are mild and others which are serious. I would urge everyone with the following problems to seek an eye specialist immediately, namely, sudden and persistent visual loss or change, severe eye pain, or trauma and injuries. If you have any doubts about your eye condition, it is better to see us early rather than wait for it to get better on its own. As the saying goes, better safe than sorry. With that, I would like to conclude my sharing today and thank everyone for your patience and for listening. Thank you.
Thank you, Dr. Anson. As far as I understand from Dr. Anson's presentation is that eye diseases could be at a wide range and the severity of its impact are usually unique at its own. So seeking a medical or professional advice serves a very important role in prevention or early detection to bigger eye problems. All right, now ladies and gentlemen, that was the sharing from our esteemed eye doctors covering some of the very important eye problems and how we can all do something about it. Our Q&A chat box now is flooded with tons of questions. Keep them coming. We will now proceed to the Q&A session to address as many questions as possible given the time constraint now. All right, so now let's begin with the Q&A session. The first questions that I see over here will be, why do my eyes sting, especially when I am driving in the evening after work? And also similar topic, one participant also asked, why is the eye getting blurriness after a prolonged hour of screen time, especially also when they wake up in the morning? Maybe I can direct these questions to Dr. Vienne. Will you be able to help us to answer this?
Yeah, okay. When after long hours of working the whole day, towards the evening, during the driving, usually we already have dry eye. And during driving, if we put the aircon directly blow on us, our eyes may get more dry. And this is the reason why you have like dry eye towards the evening and especially during the driving. And during driving also, our blinking ability also reduced because we try to stare at maybe the signboard or we want to look at the cars, how speed is the car. So we forget to blink our eyes. And also with that also will increase our dry eye. Dry eye actually can cause blurring of vision. And I have seen some of, like Carmen just now mentioned also, if patient, sometimes when they wake up in the morning, they also feel that their eyes is a bit burn, they have a bit of burning sensation. All those are related to dry eye as well.
Okay, all right. Thank you, Dr. Vienne. So the next questions coming up is that what are the factors or criteria that you will need to go for a cataract operations? Can we have Dr. Allen to help us address this question?
Yeah, I just already mentioned so you need to see an eye doctor first, okay? So if you the cataract is already disturb your daily activities, affecting your driving, affecting your job performance, then you should consider taking out the cataract. There's actually no criteria. Anyone can go for cataract surgery if you have cataract. And when you need the cataract surgery, you need to restore your vision, then you can go for it.
Yeah, okay. Dr.
Mm.
Allen, is there any indicator such as a reading or a percentage to tell whether the cataract has worsened?
Okay, usually sometimes we will follow up the patient. Sometimes if they have early cataract, because it's very subjective. Sometimes we just take some picture, the photo on the lens, and we compare the visual acuity after 6 months. We show the patient the photo of the cataract 6 months before and 6 months after, and also if the symptom become worsen, then mean that the cataract become worsen, then you need to take it out.
Yeah, sure. Okay, thank you, Dr. Allen. All right, so now the next question is, I have had a drainage implant to both my eyes 6 years ago. How will I know that the drainage shunts are still in place and properly positioned? This is by our reader, Richard. Can Dr. Anson probably help us to address this question?
Okay. A drainage shunt can mean a lot of things, but I would assume that you mean a drainage shunt due to glaucoma. So, because the drainage shunt is usually the procedure is usually done when the glaucoma is very serious to stop the process of damage to the glaucoma. So normally to assess whether the drainage shunt is working or not, you will need to see how high is your eye pressure and to monitor the visual field to know whether the glaucoma is progressing or not. So we still need to know a lot about your history, your previous history, before we can answer the question regarding whether the shunt is working or not.
All right, so in short, I think we still need to go through an eye examination to really diagnose and to plan the management for the above patients, yeah? All right, so the next question is that I heard that there is blade and no blade cataract surgery. Which should I choose? And another question also similar to this, if my mother or my parent is already 80 years and above, whether is it still safe to go through a cataract surgery? Dr. Allen, would you like to enlighten us?
Okay, actually, standard is what we call the blade cataract surgery. It's actually a standard cataract surgery. We use blade, we do a lot of manual steps to take out the cataract. But in the new generation, what we call a no blade cataract surgery, many steps is already replaced by the laser. So actually, nowadays we actually advise, we like to encourage patients to do this no blade because this surgery actually have an advantage of making more precise surgery, more faster surgery, and also is what I call less error. Okay, so whether your age is a young age or old age, actually everyone is suitable for this new generation of cataract surgery.
Okay, all right. Thank you, Dr. Allen. All right, now this question is directing to Dr. Vienne. If facing the computer for long hours can cause dry eyes, what can I do to reduce it? And whether wearing the anti-blue light glasses can protect the eyes?
Okay, if we have no choice, we need to expose the computer for long hours because we need to work like from home. Let's say now during MCO. So what you can do is, like what I say, 20-20 rules. After 20 minutes, you just rest about 20 seconds and look at the 20 feet object. But if let's say you find that it's a bit hard to do that, what you can do is after 2 hours, you spend the whole 2 hours of looking at a computer. You should actually rest for at least 15 minutes to close your eye, to relax your eyes. If not, you might get this digital eye strain. Okay, what else you can do when you're looking at a computer to reduce your straining of the eyes? You can reduce the glaring of the eyes by reduce the light of the computer setting. Means that make sure that the light is not too bright or too glare for you. And your background object also, try not to face your computer directly towards the window, or you open your window very bright. So means like when the light coming from the outside is a bit too glare for you. Or you can close the window, or you can put on.
All right, Dr. Vienne, yeah,
make sure.
okay.
Yes, sorry, it's too long. Sorry. So I cut it short.
Go ahead.
For the anti-glaring, for means like just now you mentioned that UV light. UV light can UV light. How to say? Sorry, it's blue light. These glasses actually they can filter out a bit of the UV light. That one also can help. But you can use anti-glaring glasses if you want to help to reduce the glaring when you use the computer.
All right, thank you, Dr. Vienne. All right, to Dr. Anson. So this participant said that her floaters are not just a tiny black spots floating around, but lightning flashes. Her eye specialist claimed that she has dry eyes and have given her some eye drops. Been many years, but it's not getting any better. Is there any suggestion or is there any advice from you?
If I understand your question correctly, this patient is having floaters for very long, for a few years.
Yes, correct. And also
flashes for more than
flashes, yes.
Flashes for a few years.
Yes.
But, according to if you heard my presentation just now, most of the flashes are due to a process called posterior vitreous detachment, where the vitreous is pulling on the retina, and it is an age-related change. Normally, this process takes a few months to complete. So if the flashes has been there for more than that, then there could be other reasons to explain the flashes, such as some people have visual migraine or even migraine, where they have auras, and this may explain why she has flashes. So in order to know what is the cause of the flashes, we have to actually see the patient and examine the eye thoroughly to know what is happening.
Okay, all right. Thank you, Dr. Anson. All right, the next questions, can we have Dr. Allen to help us with this? The patient is asking, is there any side effects after cataract operations, such as dry eye, and what are the risks of a cataract operation?
Okay, I'll talk about the risk of cataract. Okay, cataract is just like any type of surgery. There's a risk of infection. The first one is infection, but infection rate in cataract is very, very low, less than 0.01%. Okay, second one, cataract surgery, if you do late or when the cataract is become very dense, so you need more energy to remove the cataract, and this can actually lead to corneal injury. Okay, the third one, you can actually, risk of cataract include the retinal detachment, especially in very dense cataract. And also, if your cataract is very dense, there's even a risk during the surgery, we actually rupture the capsule, where we can't actually implant a new lens and the lens, the proper artificial lens into the eye. So we have to use some secondary lens, which can actually lead to poorer visions. Okay, so this is the some risk of cataract surgery, especially when you do it late. Okay, cataract surgery actually will not directly lead to dry eye, but during the first few weeks of the cataract surgery, post-cataract surgery, you need to use a lot of medication. The medication actually can lead to some dry eye problem. Okay.
Okay, Dr. Allen, will our wish get blur after cataract operations? And let's say if it get blur after a few years, is there anything else that we can do on top of that?
the cause of blurring of vision after cataract surgery can be many. Okay, if related to cataract surgery, most of the time is after 1-2 years. Usually after 1-2 years, the artificial lens when you put in, there's a capsule holding the lens, which is initially transparent. Later on, it will become a bit of opacity. This opacity actually will blur your vision. So if this happens, we call it PCO, and we can actually easily treat it by using a laser just to remove the PCO. So it takes about less than 1 minute. So it's a very simple procedure. But if your vision become poorer and poorer after a few years after cataract surgery, it can be due to other problems, can be due to some retinal problem, corneal problem. All this you need to check with eye doctor first.
Okay, all right, thank you. All right, now back to Dr. Vienne. Is there any significance when our eyes become dry due to allergy reaction? We can feel itchiness and it will become red and swollen. How can we check it, or how can we do something about it?
If we have allergic eye, definitely we will have dry eye. So as long as we treat the allergic eye, the dry eye will resolve by itself. So what we should do is you should go to see the ophthalmologist, seek the advice from the doctors. They will give you the proper treatment.
Okay, all right. So meaning we still have to get diagnosed by the ophthalmologist first before getting it treated with medication. Yeah? Okay.
Yes.
All right. So the next question is, opticians claim that they can prescribe lens with coatings that filter blue rays from computer screen. Can this coating filter this blue ray and hence reduce dry eyes problems, Dr. Vienne? Her question is that the blue filter, prescribed by the opticians on a lot of glasses, would that help in reducing dry eyes problem?
They are not directly helping in the reduce the dry eye. The coating of the glasses blue light actually is for the filter of the UV light, but it's not for the dry eye. For the dry eye, actually is more like just now we had mentioned the field measurements. So if you want to reduce the digital eye strain, what you can do is you can get some like anti-glaring glasses to help you instead of the UV light coating.
Okay, so there's no direct correlation between using a blue filter coating to dry eyes solutions, right, Dr. Vienne?
Yes.
Okay,
yes.
All right, thank you, doctor. All right, now back to Dr. Anson. This question is asking, how can diabetes causes cataract? And the next one also is, if these patients have floaters, whether can eye drops help him with the floaters problem?
How does diabetes cause cataracts?
Yes, correct.
Yeah, people with diabetes can actually get cataract earlier than other people because diabetes itself is a metabolic problem, which sometimes we think that the high sugar level can actually lead to the cloudiness of the lens by disturbing with the metabolism of the lens. So this is one way how diabetes can lead to early cataracts. If the patient has floaters, can eye drops treat the floaters? Well, we've all heard about miracle eye drops that can treat a multitude of problems, from vitreous floaters to glaucoma to cataracts. But sad to say, all those claims are not founded, and I urge the public not to believe in all those eye drops that claim that they can work to remove floaters, because floaters actually come from inside the eyeball itself. There's like debris or collagen collections, fibers inside the vitreous. You can't actually dissolve these floaters with any medication itself. The only way to remove floaters is actually through surgery.
I see. All right. Thank you, Dr. Anson, for addressing the questions. Dr. Allen, so this question is directing to you. This participant has done his or her cataract surgery 3 years ago with a monofocal lens. Can he or she improve by doing the trifocal now, and whether is it a costly procedure?
Actually got two choices. First, actually you take out the original monofocal lens and implant the multifocal lens. But this is quite a complicated procedure and it's quite costly. Second one, actually there's new lens. You can, what you call an add-on lens. You can actually add on what I call a multifocal lens on top of their monofocal lens. And this can be easily done, but it's also very costly.
I see. Okay. All right. Thank you, Dr. Allen. All right. I think we will take probably a few more questions. There are still questions coming in. All right. So also again to Dr. Allen, this patient says that the optician claims that her cataract doesn't need any surgery at the moment, but need to upgrade her spec and change new spec often. What should she do, and whether is this the right thing to do?
Okay, if the cataract is still early, then it's possible to improve your vision by changing the glasses. But even when after you change your glasses, your power keep on changing and you can't really see clear, then this is a time for you to look at the eye doctor to confirm that your cataract is become worsened and no other problem. So if you really want, and also the other thing, if you really want to be spectacle free, you don't want to spend so much on changing your glasses, then you can consider cataract surgery anytime. Doesn't mean that you have early cataract, you can't do it. And okay, so by modern cataract surgery, actually we can take away cataract and also can make you spectacle free. Okay.
Okay, all right. Thank you, Dr. Allen. All right, now Dr. Anson, this reader is called William. He's 65 years young, and he had glaucoma in his left eye, being prescribed with eye drops. Is there any other methods besides than using eye drops? He learned that this glaucoma is possibly cannot be cured. Is there any other advice for him?
Okay, so to treat glaucoma, the most effective way for us to slow down the damage from glaucoma, because glaucoma is a disease that cannot be cured. The only thing we can do is to slow it down. And the only effective way for us to slow it down is by lowering the eye pressure. We can achieve a lower eye pressure through three main methods. One of it is using eye drops, which is the main way. The second way is through laser. And the third way is through surgery. So because medications or eye drops have a good safety profile, that is why most people would start eye drops as the main treatment for most of their patients before moving on to laser or surgery.
Okay, all right. Thank you, Dr. Anson. Now, Dr. Vienne, I have one question which is not so related to your topic today, but I think maybe you can help us to address this. Is there any solution for lazy eyes? Any operations available?
Lazy eye, actually, there is a problem of development of the visual pathway, immature abnormal development of the visual pathway, and this usually is happen during the young age. So it's for lazy eye, we actually have some treatment where if patient is still young, it's a kids, usually they ask the patients to do a patching. For adult, usually after like more than 8 or 9 years old, for the more older age group of the kids, usually we still can do patching, but we will try other methods also. So for the adult, now we have more new treatment for the lazy eye, what we call as this, usually we do we call as the real virtual vision to help you. So this is what usually we have in our Vista now, which we can try to help you. So lazy eye cannot do surgery, actually, cannot cure.
I see.
Okay.
I see. Also, the same question related to lazy eye by David. He said, if he has lazy eye, will this lazy eye vision be improved by using laser treatment or by LASIK? I think he referring to LASIK.
No, lazy eye can be improved by, just now I mentioned, patching if you are still in a younger age group, or now we can do this vivid vision, is to improve your vision. Although it's like cannot go back to like 100% like young kids where we can reverse your lazy eye 100%, but what we can do is at least we can improve your lazy eye by using this vivid vision.
Okay, All right, thank you, Dr. Vienne. I think we will take 3 last questions before we wrap up the session. All right, so these questions, probably Dr. Allen can help us with this. After cataract surgery, can I choose not to wear glasses, as I find glasses are very troublesome? Is there any lenses available in the market, for a cataract surgery to help this patient?
Yes, just like I said, we actually can customize your vision after the cataract surgery. So if you don't want to wear glasses, then the only solution is by implanting a multifocal lens, or we call a trifocal lens. The trifocal lens actually can help you to see far, like driving, can see intermediate distance, like computer distance, or near distance, like handphone distance reading. So after implanting the trifocal lens, most of the patient, I can say, we usually tell patient 95% of your time you doesn't really need glasses. But sometimes you still, like if you want to see small print, sometimes you still need the glasses help. But by implanting the trifocal lens, you actually can basically throw away your glasses.
Okay, all right. Okay, thank you, Dr. Allen. All right, Dr. Anson, at times when reading the screen with a white background, I find it difficult in reading the text copy. Is there any reason why is that so?
Okay, so if you have problem reading, that can imply a problem with your central vision. There are many causes why our central vision can be disturbed. As what I mentioned in my talk, 2 of the most common are age-related macular degeneration and also diabetic maculopathy. But there are also other causes which can cause your central vision to be affected, including things like epiretinal membrane. So if you still cannot read properly, even with the correct prescription, then you have to go and see an eye specialist to check your eye to see if there's any problem with the macula or even with cataracts.
Okay, all right. Okay, thank you, Dr. Anson. I think we'll come to our last question. This question, maybe Dr. Allen, is related to cataract. This participant is saying that he is now 30 years old, whether he is a suitable candidate to go through, a cataract surgery.
Okay, 30 years old, if your vision is still clear and you don't have cataract, actually why you need a cataract surgery. If you want to have a vision correction, if you're wearing glasses, you want to have vision correction, there's many ways like LASIK, ICL, implantable contact lens. Unless you diagnose to have cataract, then we can do it. Even you are 20 years old, you have cataract, we can do anytime.
Okay, all right. Thank you, doctors. Thank you, Dr. Vienne, Dr. Anson, and Dr. Allen for addressing all the questions. If your questions or your doubts are not being answered at today's session, don't worry. This recording will be sent to you, and also feel free to drop us a message. We will try to get back to you after the webinar. All right, so that marks the end of our Q&A session. Thank you so much to all 3 doctors for sharing with us today on eye care related topics and for addressing all the questions raised. Before we end the session, is there one last take-home message that the doctor could share with us to the participants tonight? Maybe you can start from Dr. Vienne.
Yes, actually this digital eye strain actually is the more common recently due to increase of our demand on and also the needs of using these electronic devices. So in order to have a better quality of life and joyful working environment and also joyful PC time, we call it the screen time, we need to address this issue seriously because to some patients, actually this problem actually can be very depressing.
Thank you, Dr. Vienne. Can we now have Dr. Allen to share us your last word?
Okay, if you already diagnosed to have cataract and the cataract already affecting your daily activity, do not delay the surgery, as the modern cataract surgery now is very safe and effective and actually will give you a life-changing result.
All right, thank you, Dr. Allen. Last but not least, Dr. Anson.
Okay. I hope that I've created awareness for people to see an eye doctor if you have any eye problems. Thank you.
Thank you, doctors. Thank you, doctors. And again, thank you to all of you who have joined us tonight. We hope you find this session useful and insightful when it comes to eye care related problems. Before you leave the room, we appreciate if you can spare us a few more seconds to answer the poll that will be popping up on the screen shortly so that we can know your feedback and to improve better for the future sessions. Thank you once again to every one of you tonight. We hope you stay safe, stay well, and stay healthy. And let's all go through this crisis stronger together. Thank you again to all our doctors, and thank you everyone for joining us tonight. Thank you everyone. Goodbye.
Thank you.
So we actually can leave now, right?